My name is Jan Sill, and I live in Hendersonville, Tennessee. I'd like to start at the beginning of my mother's story. 20 years ago, she was diagnosed with inoperable lung cancer, and I was told by considered the best hospital in America in Houston, that she only had about 2 months to live. So I really wanted to do something for her, but I didn't know where to go or what to do. So I was told by a best friend of mine that I should call a group in Fort Lauderdale, Florida called the Life Extension Group. And it's a large board of integrated medicine doctors. And so that's what I did. I called them and I spoke with a doctor there. And he told me he recommended this hospital, which is BioCare in Tijuana, Mexico. At that time, it was American Biologics Hospital. So within a week, I had my mother here. She came in a wheelchair. She also had a heart condition. And Dr. Romero, our doctor here, told me that her heart condition was just as bad as the cancer. So she was in a very bad situation when I brought her. My first concern was that she wasn't eating anything, and I couldn't get her to eat. And she was losing weight. She weighed less than 100 pounds. And Dr. Romero said, "Don't worry, we will have her eating soon." And I thought, that's impossible. I can't get her to eat. But within a very few days, she was eating. And she was eating very healthy food that's here at this hospital. And that's one of the things that changed our life, was that we learned how to eat for cancer patients and for me. So it was a wonderful experience. She came in a wheelchair. We were here for 3 weeks, and she got the best care. And the doctors here, I cannot say enough about them. What I feel about them is they're very engaged with the patient. I didn't feel as though she was a number or a list of patients. I felt like that she was really on their mind of what to do for her specifically. And the education that we got here on how to take care of her and what to do for her. So after 3 weeks, I took her home. I took home 6 months of supplements and the medications to take care of her, including giving her shots, which I'd never done. And little by little, fractionally every day, she got a little bit better, a little bit better, a little bit better. And we left here on January the 1st, and months passed. I could see her little by little getting stronger. It was not fast, and it was a diligent, I call it a war against cancer. And on the 7th month, one day she came in and she said, "I'm ready to go home." And she went home and resumed her life, and went to church, went to the grocery store. She was 83 years old. And I said she was a young 83 years old. So she was an overcomer. Now I'm here again. I brought my husband here, who has cancer and has unusual neurological episodes. All the doctors from many hospitals in Nashville, Tennessee, there's a lot of them. Vanderbilt is one of them that we were at. No one has been able to find the source of these episodes. And they're very difficult. And it's almost like a seizure, but it's not. But I do find that the doctors here are so engaged to help him. And they're doing things and therapies. We are busy from morning till night of helping him. And he hasn't had an episode in many days now. And he was having them quite frequently. Very concerning. And the flight here, he had an episode for 4 hours that was very difficult for him. So I have high hopes. I know that it worked for my mother, and I believe it's going to work for my husband. Thank you.